10.
Good morning or good afternoon, everyone, depending on where you are. My name is Jack Miller. I'm the president of Pacific College of Health and Science, formerly PCOM. I'd like to welcome you all to this very, very interesting presentation by Dr. John Chen. I was privileged to watch and hear most of it yesterday. You guys have something really exciting to look forward to, extremely informative. One of the most informative presentations that I've heard in my many years of listening to presentations at college and at our symposium. Dr. Chen's participation in the family tradition has led him to become a recognized authority in both Western pharmacology and Chinese herbal medicine. He's taught herbology and pharmacology at, and now the list is so long, I can't even read it all, at almost every college of Chinese medicine in the country. And he's also spoken at almost all of the prestigious conferences that we sponsor throughout our wonderful profession. Dr. Chen is currently a member of the Herbal Medicine Committee for the AAOM, and he's an herbal consultant for CSELMA, which is our California State Oriental Medicine Association. And he's on the review editorial committee for the Acupuncture Herbal Pharmacopoeia, the University of Arizona Integrative Medicine Program, and the American Academy of Medical Acupuncture. I hope you're aware of his numerous articles and several books. He is too generous and modest to say, go buy these, but if you don't have them, I'm not. I think he's done such a tremendous job here, and he's been so generous with his time, the time that he spent with you today and yesterday, and obviously the tremendous amount of work that's gone into preparing this presentation. He deserves all of our gratitude. I'd also like to thank Carl Schwartz from LASA for co-sponsoring this event. And if Carl, if you'd like to say a few words, I'll turn it over to you.
Excellent. Thank you, Jack. I appreciate it. And thank you as well, Dr. Chen. 2 days ago, Dr. Chen was very gracious to give 2 hours of his time to walk everyone through who attended that webinar, to walk everyone through this unbelievable content. And just based on the feedback we got, you are in for a well-spent 2 hours. We had over 1,500 people attend, and since we've had over 5,000 people view that video. So in the course of a week, Dr. Chen will have delivered this to probably 7,000 to 8,000 healthcare practitioners. So thank you for attending, and thank you for continuing to focus on patient health and well-being. And just a kind of plug about Las OMS, we are still here. We're still here for you. We have plenty of supplies. And if there's anything else we can do, pick up the phone, send an email, and let us know. Thank you very much.
With that, we'll turn it over to Dr. John Chen.
All right, thank you, Jack. Thank you, Carl. It's a pleasure to be here. This is my 3rd time doing this class. And the class is obviously how coronavirus or COVID-19 is treated with TCM in China. What I have learned in the last 2 presentations is that while there's a tremendous amount of information that I'm going to be presenting to you, there seems to be a lot of questions as well. And the question mainly is focused on, well, this is how COVID-19 is treated in China. How do we do this in the United States? Okay, because not everything they do in China can be done here in the US. Okay, and also in the last probably month or so, I have gotten no less than thousands of questions. So what I'll do today is, I would say 80% of the presentations will be the same as the last 2, but I will spend a little bit more time to address some of the common questions that many of you have had and asked. That way, it will be mostly the same presentation if you haven't heard it. But at the same time, if you have heard it, hopefully you can walk away with something new as well. All right. Like I mentioned, there's going to be a lot of slides, probably about 130, 138 or so. I will focus most of today's class on TCM, because I think that's why all of us are here, to learn about TCM and what TCM can do for COVID-19. But I think we need to start with some quick background and also information regarding Western medicine. That way we have a common definition, common starting point before we dive into TCM. All right, so that will be the emphasis of today's class and for about the next hour and a half or so. All right, and also before you start, if you don't have the PowerPoint or the PDF, or if you want to listen to this over again, you can go to the eLotus source web link, and it has all this information here. And I'm sure PCOM and also OMS LASA will be happy to send you the link of today's webinar on YouTube and also the one on Thursday as well. Anyhow, my presentation is here. A lot of the link, a lot of the information that I talk about are all here as well, including all the articles, all the interviews, and so on and so forth. All right, so if you are interested in reading more, in learning more, feel free to go there, and the information is all there. All right, so with that, let's go ahead and get started. Let's start first with the general information about the biology of coronavirus, and I think this is important. All right, so coronavirus is an RNA virus, and there are actually many different strains of coronavirus. Fortunately, most of them are not harmful. They may cause mild common cold or influenza type of signs and symptoms, but in most cases, that's about it. The three that are more pathogenic, one is MERS, one is SARS, and one is COVID-19. Okay, and as far as today's class goes, I think SARS and COVID-19 are the most important. And the reason is because SARS, which is severe acute respiratory syndrome, is caused by the virus that's called SARS-CoV or SARS-CoV-1. And then COVID, of course, stands for coronavirus disease. 2019 is caused by the virus named SARS-CoV-2. Okay, and the reason that they are named so close to each other is because not only are they 96% identical as far as the genome, they cause very similar signs and symptoms. Primarily the spikes on the virus, the protein spikes, when they go into the body, they primarily attach to the lung receptors. And once they attach to the lung receptors, they go into the host cell, which is the lung cell. They start to replicate and release the virus that way. But at the same time, most of the signs and symptoms, most of the damage are done to the lung. Okay, and that's why the disease is called severe acute respiratory syndrome. So most of the severe signs and symptoms are going to be lung related. All right, so quick background, incubation period is about 2 to 14 days, and on average about 4 or 5. Okay, so if you're exposed to somebody who had the virus, you may or may not show symptom for the next 2 weeks or so. All right, the symptoms are mostly going to be related to your respiratory tract and also your GI tract. With respiratory tract, the generic or general signs and symptoms are fever, dry cough, sneezing, runny nose, some sputum production, but usually not too much, nasal congestion, shortness of breath, lethargy, muscle aches and pain, headache, and maybe dehydration. Okay, so as you can see, most of these signs and symptoms are rather generic and rather non-diagnostic. All right, so especially since this occurred during the flu season, you really in the beginning don't know whether this is a common cold, influenza, or COVID-19. Okay, and what's even worse is even if you do have the virus with COVID-19, a lot of time the patient may be asymptomatic. Okay, so this is background that I think most of you know already. And then in addition to the respiratory signs and symptoms, 5 to 10% of the patient can also show GI signs and symptoms, mostly diarrhea, nausea, before the respiratory symptoms. Okay, and that also means that the virus can also be present in the stools. Okay, so it can be transmitted via the droplets in the air. It can also be transmitted through the oral fecal route. Okay, so keep that in mind. So what happens then is, let's say if the virus gets to you're exposed to the virus. It starts out in the upper respiratory tract, and then as the disease progresses, it can then obviously go inwards. And the next place that it goes is going to be to the lung. All right, so once it goes to the lung, the patient will start to show more significant lung signs and symptoms. So you may start out with wheezing, dyspnea, shortness of breath, dyspnea upon exertion. So basically all the breathing signs and symptoms. Okay, so those are early signs of pneumonia. Then obviously that can turn into something more significant. And as they go to the hospital to get checked out, obviously their CT scan or chest X-ray is going to start to show the lung being affected, all right? And then as the disease progresses, the coronavirus may trigger something called the cytokine storm. And what it is as the virus starts to replicate in the lung, the immune cells detect something is wrong. It detects the presence of the virus. And sometimes the immune cells will hyper respond or respond in an uncontrollable, dysfunctional manner, much like an autoimmune disease. So it's going to cause a severe inflammatory response. The immune cell will release a lot of cytokine, which triggers the immunity response. So now the immune system will attack the lung cells, will attack the lung tissues. And also there's so much inflammation at the same time. And what's going to happen is this is going to cause a severe inflammatory disease, something called the ARDS, acute respiratory distress syndrome. So you have a lot of inflammation. It's plugging up all the airspace inside the lung, leading to very difficulty in breathing, not getting enough air and oxygen into the lung. And if the lung does not get enough oxygen, then what happens is the oxygen cannot pass on to the blood and cannot be passed on to the rest of the organs, the vital organs. So what may start as early signs and symptoms turn into pneumonia, turn into acute respiratory distress syndrome. And then when the body doesn't get enough oxygen, then you have multiple organ failure. All right, so this is really the turning point in which the disease starts out as a minor cold and flu-like type of signs and symptoms, and eventually it may become lethal. Okay, so this is what we all have to watch out, okay, in terms of detecting the disease as early as we can, and then start to treat it. All right, what also happened, and this is very important, is like we mentioned, in addition to the hyperinflammation, okay, lung suffers both actual physical injury and also physiological compromise. So the actual physical injury is the immune system, the pro-inflammatory cytokines will actually do damage to the lung lining itself, so the lung will be damaged, okay? And then once the lung is damaged, once the anatomy is damaged, the physiology will be compromised as well. So now you will also have wheezing, shortness of breath, and so on. Okay, so basically form and function, anatomy and physiology will always go hand in hand. Okay, and then when the patients, when they get biopsy, when they do biopsy to see the actual lung itself, what they find is that there is edema, there is proteinaceous exudate, there is hyperplasia, overgrowth of the lung cells, and also a lot of the fibroblastic plugs. Okay, so what that means is in a healthy person, usually the lung is like a very soft sponge, all right? So if you were to be able to touch it, it's very soft, it has a lot of flexibility. So when you breathe in, a lot of air is able to go inside the lung and your lung is able to extract oxygen out of it. But what happens is when COVID-19 causes ARDS or causes cytokine storm, there's so much inflammation, and inflammation is in the deep, furthest part of the air sacs. All right, so it's filled with not something that's watery, but something that's very thick, very sticky. And in fact, that's basically the hyperplasia of the lung cells and also the fibroblastic plugs. So the lung becomes very thick and rubbery and glue-like, so it no longer has that elasticity. All right, so the anatomy of the lung has significantly changed in these patients that suffer from COVID-19 lung damages. All right, so those are the general signs and symptoms. And as far as diagnosis goes in Western medicine, obviously the first thing that the doctors will do is some signs and symptom evaluation. So much like the respiratory tract and digestive tract signs and symptoms that we mentioned earlier. They will also ask the patient about their past travel history, whether they have been to any of the hot zones or hot areas. But at this point in the US, I don't think that's relevant anymore because the disease originated from China, from Wuhan, in Hubei province, but now it's everywhere. And so for a lot of patients, obviously they have never been to China, but there's a very high chance they have gotten it through many people, that have come in contact with the original patients. So once again, so the history is not that relevant anymore. Testing wise, it's mostly going to be through the nasal pharyngeal swab. Okay, so they are testing for the RNA fragments from the virus. And then when the patients start to show lung signs and symptoms, they will also do chest x-ray and CT scan to see if the lung is showing indications of pneumonia. All right. And if they do, then as the patients are admitted to the hospital, they will do CBC, which is complete blood count, and they will find two things that are quite significant. One is lymphopenia, and the other one is thrombocytopenia. So lymphopenia is seen in about 80% of the patients. Okay, so that's the decrease of the lymphocytes. Okay, and lymphocytes, there are three main lymphocytes. There's a T lymphocytes, B lymphocytes, and NK, natural killer cell lymphocytes. And all three play a very significant role in the immune system. Okay, and then obviously if you have a low thrombocyte or low platelet count, in Western medicine, that's a very poor diagnostic sign. And the reason is because once the lung starts to get affected, once the lung starts to swell up and have all these inflammations, not only do you have lack of oxygen, you have lack of platelets that's able to carry oxygen to the rest of the body. Okay, as far as general treatment goes, at this point, the SARS-CoV-2 originally was called the novel coronavirus. Right, so it's novel, it's new. So what happened is in Western medicine, there is no treatment for COVID-19. Okay, so all the treatment are basically supportive treatment and experimental treatment. Okay, so keep that in mind. There is no treatment, there's no cure at this point in time. Okay, so if the patient comes in with fever, muscle aches, and pain, then most likely they will prescribe acetaminophen, which is Tylenol, aspirin, and maybe ibuprofen. But since this PowerPoint was created, the French doctor has sounded that ibuprofen is not ideal because it may worsen the COVID-19 condition. And then since the alarm, WHO actually concurred. So if you have patient, that have signs and symptoms, it's better that they don't take ibuprofen over the counter and try to treat themselves. Okay, but if it's prescribed by the MD, then obviously they may know something that we don't. A lot of these patients may also get antiviral treatment. Okay, none of these antiviral drugs are specific for coronavirus 1 or coronavirus 2. Okay, but these are all they have. So this is basically experimental medicine at this point. Remdesivir is originally trying for Ebola virus, and lopinavir and ritonavir is a combination that's used for HIV. And again, since the PowerPoint was created, I think this came out on Thursday morning, the clinical result from China of about 190 patients is that the combination of these last two antivirals were disappointing and that they do not provide any additional benefit compared to patients that do not take it. Okay, so unfortunately, these two drugs that are used for HIV don't seem to work well for the SARS coronavirus. All right. Chloroquine is an anti-malarial drug that came from a natural plant called the chinchoma bark. So some countries, especially Korea, they seem to be using chloroquine and also hydroxychloroquine. Whether or how much they work is too early to tell. Okay, so it's possible they may work, but until more data is available, we don't know at this point. A lot of people also ask me about the Chinese herb, Qinghao artemisia, and whether that can be used or not. And my response is, of all the formulas that we will examine a little bit later on, Qinghao is not a main ingredient. I also haven't come across any study about Qinghao and SARS coronavirus. So again, whether it works or not, we don't really know. All right. Steroids historically have been used quite a bit for treating any kind of inflammatory disorder. But unfortunately, in this case, steroids will have significant pro and also significant con. Okay, the pro is that it's very powerful, it works right away for reducing the inflammation if the patient happens to have severe inflammation in the lung and they have trouble breathing. So that's the benefit. The risk is that steroids may also suppress your immune system. Okay, so for these patients, they are now going to be a higher risk of secondary infection, especially if they're hospitalized, right? We all know a lot of people, when they go to hospital, they end up with what's called nosocomial infection. So that's a secondary infection you end up picking up in the hospitals. And most of these bugs that cause nosocomial infection, in fact, are very tough to treat because these bugs have been in the hospital for a long time and they are resistant to many antibiotics. All right, so be careful when steroids are used in the hospital because once again, secondary infection they pick up can be quite lethal. Also, steroids have also been shown to speed up the viral shedding. Okay, so that means people around these patients, may have higher risk of catching the infection. All right. For a patient at risk of cytokine storm, then what happens is immunosuppressants may be used. So these are the drugs that suppress the immune system and the hyperactive immune system. So these are the drugs that have been used historically to treat cancer and also to treat autoimmune patients. Okay, but in this case, it's a off-label or experimental use. Okay, and then obviously the last two are not drugs, but rather machines. So patients that have difficulty breathing or about to have multiple organ failure, they are getting ventilator, respirator, and also ECMO for life support. Okay, here is another option, and this is again very old, but also somewhat non-traditional. Well, actually, I would say it's traditional, right? But it's novel. Anyways, it's called convalescent plasma or convalescent sera, and basically what it is patients that have gotten COVID-19, they survive, they heal, and they develop antibody in their blood, right? So what they do is they take the blood from these patients, they concentrate it to get the antibodies, and then they inject the antibody into the sick patients, hoping the antibody from the survivor will treat the infection in patient that's having it now, okay? And this is actually a very old concept. Chinese medicine has done this actually for a long time. Historically, that's how they treat patients that get poisoned with poisonous plants, or if they get bit by poisonous snakes and so on. So what they do is, especially for the poisonous plants, they will drink the blood from the goats or the rabbits that are immune to these plant poisons. Okay, and as far as Western medicine goes, these type of approach are also what they use to develop a lot of the vaccinations, to develop venoms and also vaccinations. All right, so basically they are relying on the immune system to come up with a cure for the disease. Okay, so they are, like we mentioned, there's no treatment at this time. Everything is experimental, everything is supportive. Okay, so in the end, if we were to fast forward to how this would end, there's only basically two ways this is going to end. One is if most of the people develop immunity to it, okay, much like chickenpox. If most people have immunity, then what happens is you are exposed to it once, you develop immunity, then you heal, okay? Or vaccine becomes available. But unfortunately, vaccine for COVID-19, according to Dr. Fauci, won't be deployed for at least a year to a year and a half. Okay, so this is likely going to be a long battle, no less than a month to maybe a year or longer. Okay, prognosis-wise, the good news and the bad news is that the bad news is approximately 50 to 70% of the people will eventually, at some point or the other, get exposed and get COVID-19, regardless of whether you have suppression or quarantine or isolation and so on and so forth. We all live in a society and we all have to interact with other people at some point in time. And unfortunately, the virus is already everywhere. Okay, so according to what the German chancellor told the German citizens, up to 70% of the people will eventually get COVID-19. But the good news is most of the patients will only have mild illness. They do not require medical attention. They don't need to be counted. They don't need to be treated, okay? And also, all the people that are infected, over 80% don't have any significant signs and symptoms and don't need to be hospitalized, Okay, another good news is of all the people that are affected, very few are young patients. Only 2.4% are patients that are 18 years and younger. So most of the young kids, young adults, seems to be fine. But the contrast to that is that patients that are 60 years and older with pre-existing health conditions are going to have the highest risk. So those pre-existing health conditions primarily refer to the lung and heart conditions. So if they have asthma, they have congestive heart failure, they have hypertension, and so on, they tend to have the highest risk to get the COVID-19, and they also have the highest fatality. Okay, and then finally, among the patients that are hospitalized, 10 to 20% will be admitted to ICU, 3 to 10% will require intubation, and the mortality is 2 to 5%, sometimes higher, sometimes lower, depending on what study you read. All right, and then assuming patients that are recovered and healed, okay, then what happened is the COVID-19 disease caused severe damage to the lung. Okay, so it's not just a physiological problem, it's actually a physical problem as well. So what happened is they cause physical problem to the lung. So even after their discharge, oftentimes they will need ventilator for support. Okay, and this is, again, as you can see on the slide, due to pulmonary fibrosis. Okay, so as they are discharged, they will need additional help, and medical treatment doesn't end just there. All right, so that's a very quick background on Western medicine and COVID-19. So let's now switch gear and talk about TCM. Okay, and let me take a little bit of time to paint you a big picture first before we go into the specifics. I think that will help you to see the big picture, where we come from, where we need to go. Okay, so you will have more confidence as you approach this topic. Okay, so the history is that in the last 2,000 to 2,500 years or so, and this is between the period of Eastern Han Dynasty to Qing Dynasty, there have been at least over 320 large-scale epidemics in China. Okay, so if you do the math, that's about one large-scale epidemic every 5 to 6 years or so. Okay, and if you think about not just China, but you think about the world today, the world is actually a very small place, right? Because of all the people that travel around, that get on the airplane and hop from one place to another. So we are basically a very small community. And if you look at the pandemic in the last 20 years or so, you know, which ones have we had? We have had SARS, we have H1N1, we have swine flu, avian flu, we have MERS, we also have COVID-19 now. You know, so that also turns out to be about 1 every 4 or 5 years. Okay, so that tends to be not the exception, you know, but rather than the norm, that we're going to see this type of epidemic or pandemic every so often. All right, so historically, there are two main philosophies as far as how we deal with disease patterns like this. The first one is Sanghan, which is co-induced disorders. And this is a philosophy or theory which is first introduced by Dr. Zhang Zhongqing. And in fact, in his lifetime, you know, he grew up at a time when, during the Three Kingdoms. So that's a time when there are three main kingdoms in China, and they are always at war with each other. So in addition to constant war, there is also a large-scale epidemic. So between the war and all the ravages that it caused, and also the epidemic, 2/3 of the population in China died during that 10 years. Okay, so that was the inspiration behind why Dr. Zhang Zhongqing decided to become a physician. And one of his hallmark as far as contribution is he introduced the concept of Sanghan Lun, right, in which a disease starts from the exterior and then goes to the interior, starts from the yang stage and goes to the yin stage. So Tai Yang, Yang Ming, Sao Yang, Tai Yin, Sao Yin, Jue Yin. Okay, so I won't go into the details. This is something that we all have studied in school already. And then what happened is, as people start to move all throughout China, you know, in the beginning, they all started around northern part of China, where Beijing is, that part of the world. And then as that becomes more and more crowded, a lot of people move away, but most of the people move south. And as they move south, what happened is they encounter much warmer, much hotter climate. And also the disease pattern tends to be very different. Okay, and sooner or later, after some time, what they notice is that the Sanghan differential diagnosis and formula don't necessarily work very well for the southern patterns of disease. Signs and symptoms are different, presentations are different. The treatment may also need to be different because a lot of the Sanghan formulas don't really work. So through contribution from many physicians, a new school of thought is developed, and that's called Wenbing, the worm diseases or worm epidemics. The names are different, but idea is about the same, and that is the disease starts from the exterior and moves interior. The terms are Wei, defense level, Qi, energy level, Yin, nutritive level, and Xue, blood level. Okay, so once again, the disease starts from the exterior and move interior, and the herbs that are generally prescribed are different. In this case, there are a lot more herbs that are bitter and cold and that eliminate toxins. And if you look at the pharmacology of the herbs, mostly from Wenbing Lun, a lot of them have effect specifically to treat viral infections. Okay, but overall, what happened is, even though within TCM the thought are different, the school are different, the big picture is the same, and that is it starts from the exterior and it moves interior. So the idea as far as treatment goes is you need to recognize what stage the disease is at, and then you need to treat it accordingly. So if it starts at the exterior, you try to release it outwards. Once it starts to go interior, you might have to do both. And then the later stages, you just have to rescue the patient the best you can. Okay, so let's see now how this applies to COVID-19. All right, so COVID-19, as we mentioned, the general early signs and symptoms are fever, dry cough, sneezing, runny nose, nasal congestion, lethargy, muscle aches and pain, dehydration, and so on. Okay, so this should be fairly obvious. This is a Taiyang syndrome type of condition. It could be wind cold or it could be wind heat. Okay, and from a Wenbing theory perspective, this is Wei or defense level, at the very beginning of the exterior pathogen affecting the body. Okay, so I think this is something that's fairly clear. There should be no problem. Then what we mentioned is that a lot of the patients, when they are hospitalized, they will do a CBC, and they find that there is lymphopenia in 80% of the patient, and a lot of patients may also have thrombocytopenia. Okay, so lymphopenia, like we mentioned, lymphopenia refers to three main types of lymphocytes. There's B lymphocytes, T lymphocytes, also people call it B cell and T cells, and also NK cell, natural killer cells. So this is equivalent in Chinese medicine to Qi deficiency, or more specifically, the Wei Qi, the defensive Qi deficiency. So in this case, the Qi is not the energy Qi, where the patient feels tired or fatigued. So if you want to clarify, and this is what some people ask, it's, let's put defense Qi. Okay, so that's your immune system. Okay, and then if the patient has thrombocytopenia, that's blood deficiency to some extent, right? You can also interpret if the patient has, whether it's red blood cells or platelets, they are both blood deficiency. Okay, so how I interpret this information is patients that have these Western findings basically are the TCM patients that may have pre-existing deficiencies, either Qi deficiency or Wei Qi deficiency or blood deficiency. So these patients are, generally speaking, maybe older patients, maybe patients that are, have pre-existing disease conditions. So once again, they are more likely to get the coronavirus infection. And once they do get it, they are less able to fight it off. So they end up with poor prognosis, and they have higher risk of getting hospitalized and maybe higher risk of mortality. Okay, so those, let's say they're otherwise healthy, they should be able to fight it off. And those that are not, then the virus may start to go from the exterior, upper respiratory tract, and then start to move into the lung. Okay, so once again, the physiology is that the virus with its spikes on the outside, attached to the lung cells, attached to the lung receptors, and they go inside and they start to cause inflammation. They start to cause shortness of breath, inflammation of the airway, and so on. And the body is now starting to fight back, right? The immune system is recognizing there's pathogen. It's attacking, the macrophage, the NK cells is attacking the virus. And there's fever, there is lung heat, there's phlegm, pulse is strong, tongue is red, and so on and so forth. So this in TCM is a yang ming stage, or the qi energy level. Okay, so this is when basically the body and the immune system is starting to battle the disease itself. All right. And then at the same time, what happened is there's a lot of inflammation in the lung, right? We mentioned there's edema, there's proteinaceous exudate, there's an abscess and pus and discharge, there is a hypergrowth of the lung cells and so on. All right. So in addition to the lung heat, basically the lung heat refers to the initial stage where there's a lot of infection and inflammation. There may also be Lan Kao, and Lan Kao is interpreted in this case as once the inflammation sets in, once there's a lot of blockage in the air sac and the lung is not able to get enough oxygen, then what happens is the body with lack of oxygen is starting to become weaker. Okay, the lung is getting weaker, the rest of the organ are not getting enough oxygen, they're also getting weaker. So the face is turning darker, there's dark purplish, complexion. Same with the tongue. Okay, so that's when the patient starts to turn from lung he in the early defensive phase to Lan Kao, when they start to not get enough oxygen. And then obviously the edema, the inflammation, the overgrowth of the lung cells and so on, that's the dampened phlegm in the lung. Okay, but in this case, what happened is that dampened phlegm is sometimes hard to detect. And the reason is because most of the patient had dry cough, right? So if you ask them to cough, or you ask them whether they have sputum or not, they'll say, no, I don't have any sputum. And don't mistaken that as there's no dampened phlegm. Because what happened is the dampened phlegm is very thick. It's a very thick type of phlegm, and it's very deep inside the lung, and that's why they can cough it out. But what happened is if you were to look at their tongue and take their paws, their tongue will be greasy, okay, and their paws often will be slippery. Okay, so that's your sign, and that's your sign that there is dampened phlegm. That's the sign there's a lot of obstruction in the lung, but you won't see the sputum very easily. Okay, so make sure you keep that in mind. And also, as COVID-19 becomes more and more prevalent, okay, well, it's already very common. Anyways, if there are some practitioners that may decide to shut their clinic, and they do a lot of telemedicine, right? So they talk to patient via Skype or some kind of video device. Make sure you observe the tongue, even if you cannot take the pause, okay? And even if you don't take the pause, just realize, when they have shortness of breath and difficulty breathing and so on, and if the tongue looks a little bit sticky, chances are they have some dampened phlegm, they have inflammation deep inside the lung, okay? So make sure you gather as much information as you can. That way you'll get a more accurate diagnosis. All right. And then what happened is as the virus triggers cytokine storm, okay, now what's going to happen is you have the immune cell that's attacking not just the virus, but it's also attacking the lung linings and also the lung tissues, okay? So what happened is the infection, the inflammation is the yang, but damage to the lung is the yin, right? So you have yang and yin signs and symptoms all at the same time. Patient may have disease that still shows outside signs and symptoms, but you also definitely have problem in the inside as well. So this is a phase that may start out as Xiaoyang syndrome, and it may stay as a Shaoyang syndrome for a while. But eventually, once the cytokine storm kicks in, eventually you will have acute respiratory distress syndrome, and you will have multiple organ failure. And at that point, it becomes a yin type of disease. So you have Tai yin, Shao yin, and Jue yin. And that from a Wenbing theory would be yin, nutritive, or Xue blood level type of problems. Okay, so at that point, the prognosis is quite poor. So our goal as healthcare practitioner is to avoid the patient from progressing to that stage as much as possible. Okay, and then finally, like we mentioned, most of the patients are fine. A lot of the patients do heal and recover, but even when they do, they will be leaving the hospital with some physical and physiological damages. So basically, they suffer damage to the alveolar space, to the linings, the membranes inside the lung, and that will then cause trouble to the lung function, including wheezing, shortness of breath, and so on. So the physical damage is basically your lung yin deficiency, okay? And the physiological compromise, the wheezing and shortness of breath, is basically your lung qi deficiency. So these patients, as they are discharged, almost always have yin deficiency and qi deficiency. Okay, so in Western medicine, again, they generally send the patient home with ventilator if available. In Chinese medicine, ideally you send the patient home, or once they come home from the hospital, you give them herbs that tonify yin and tonify yin and tonify qi. Okay, all right. So that's the quick overall picture of diagnosis. All right. The good news and bad news with COVID-19 is that this first happened in China and then the rest of the world. So the good news is that we have some time to prepare, okay? In China, up to this time, as of late February, over 60,000 patients or 85 of all the patients, some studies will say 90%. So anyways, about 85 to 90% have received herbal treatment along with Western medicine treatments. Okay, so we can learn quite a bit from what China has done to help to treat the patient and learn from it. So that's the good news. Okay. Also, at this point, what happened is pretty much everybody around the world is looking to China, looking to Taiwan, Singapore, and Korea, and also Italy for that matter, to see what is the right thing to do, what are the things not to do, you know, both in terms of what government should do and also what medical system should do, okay? And in fact, Italy at this point in time has invited many doctors and people from Wuhan in China to go to Italy to help them out, to, you know, to advise them on what they are doing right and what they are doing wrong, okay? So the good thing is this happened in China. We have, you know, maybe 2 or 3 months to learn, to observe, and then try to, you know, make the best of it. But the bad news is a lot of the herbs that are used in China to treat all these patients, what happened is either the herbs are all used up, okay, or because of the lockdown in China, what happened is a lot of the herbs can't even make their way out of China, okay? So as we talk about different herbal treatment for patients, keep in mind that not all the herbs are available, okay, either because of legality purposes or because they're completely sold out, okay, or they might have, you know, already gone up in price quite a bit. So the bad news is that we don't have the same tools. We don't have all the tools that are available. Okay, so what you need to do is you need to be open. You need to be flexible. You might also need to do some research. So if certain herbs are not available, then be open to use other herbs, use other substitutes. Okay, but I think that overall should be, in most cases, can easily be done. Okay, so that's a challenge, but it's not something that we cannot conquer. All right, so what we're gonna do now is get into the details, okay? What I'm gonna present to you are 3 treatment protocols that seems to work very well in China. The first one is Hubei Shengzhong Yiyuan. So this is the Hubei Provincial Hospital of TCM. The second one is a treatment protocol from Wuhan Yiyuan. This is the Wuhan Union Hospital of China. And the third one is an official publication called Guidance for Coronavirus Disease 2019. All right, some quick introduction about these 3. Hubei is obviously the epicenter, is the city in which the outbreak first happened. Okay, so the people in Hubei, Wuhan, have the first-hand knowledge of how to deal with this. Okay, and Wuhan is a city in Hubei province. Okay, so Hubei province also have learned quite a bit because they are also hands-on as well in how to deal with this. And then what happened is, as these people in the epicenter deal with this, they did a lot of trial and error, and they sent all the information they know to the central government in Beijing, and then the Beijing evaluate, and they start to put all these pieces of puzzles together, and they come up with their own guidance for the rest of the provinces. Okay, so the first, I don't know when the first edition was published, but I do know as of now, this is March, right? We already are at the 7th edition of this particular book, right? This is a blue book called the Guidance for COVID-19. So we are at the 7th edition already. Okay, so all these information, once again, are available at the eLotus website if you want to go into the details. And in fact, the 6th edition is the English version. So you can go to it, download it, and read the whole thing. It's about 200 pages or so. And the 7th edition goes back to Chinese only. But I think for academic or for clinical purpose, 6th edition will be just fine. So what you will notice here is that the exact protocol of treatment is going to be slightly different, but more or less they are very similar to each other. And that is basically you want to focus on 4 main stages. Okay, the first stage is going to be prevention. Second stage is the early phase. Third is the pneumonia phase, and the 4th is recovery phase. Okay, so prevention obviously means you want to keep the people that are healthy, you want to keep them healthy, right? So what you can do to make sure that it stays that way. Early phase is when they start to have the early signs and symptoms. They start to have fever, shortness of breath, dry cough, fatigue, and so on. Okay, so at this point, it could be a common cold, it could be influenza, it could be COVID-19, it could be other infections. Okay, so if you're not sure that this is the very early phase, and generally speaking, how you can treat that. And then once again, if the disease continue to progress, the patient start to show long signs and symptoms. If the patient is confirmed to have COVID-19 and they are confirmed to have pneumonia. So this is a pneumonia phase where they start to aggressively treat the patient. Okay, and sometimes the treatment is purely TCM. Sometimes they combine TCM along with Western medicine. Okay, and lastly is the recovery phase. Okay, so within these big phases, there are specific differential diagnosis and also different herbal formulas. But I will just tell you, they are more or less the same. Okay, so if you can see the big picture, this is similar to the Sanghan theory and also to the Wenbing theory. Once again, disease starts from the exterior, it moves interior. And you treat it based on who it is, based on your specific differential diagnosis within those phases. So as you approach this, as you begin to maybe see patients, keep this in mind, okay, and you won't be so lost, I promise you. It's much like the rationale, okay? So let's say if you ask me, how do I go to Canada, right? Well, if you're in the continental US, just go north. If you continue to go north, you will end up in Canada. Well, how do you go to Mexico? Well, same thing. If you go south, you will eventually end up in Mexico, okay? So same thing with this, if you recognize what phase the patient is in, prevention, early pneumonia, or recovery. If you recognize that, then what happens is there are many paths, there are many formulas that you can use as long as they are appropriate for the phase, the patient will do fine. All right, so let's now start with the first treatment protocol. This is the Hubei Provincial Hospital of TCM. And once again, they divide the 4 phases into prevention, early phase, pneumonia, and then recovery phase. Okay, and within the early phase and pneumonia phase, they have specific differential diagnosis. Okay, and then they have formulas accordingly. Okay, so one quick word is that ideally, right, TCM has a differential diagnosis for every single patient, and you write a customized formula for all these patients. But what happened is in China, when this occurred, they have an epidemic, and they have thousands of patients that all come in at the same time. And there's simply no time to interview every patient and write specific sciences, specific formulas. So that's why they end up with a main category, so the 4 phases, and then within some of the phase, general, most likely differential diagnosis. And that way, it will save a lot of time for the doctors, it will save a lot of time for the pharmacy to write and prepare the formulas. Okay, so this is how they ended up dealing with this epidemic in China. Okay, so once again, we can keep that in mind. And once again, if we have the big category correct, big phase correct, once again, the patient who take the herb will definitely get better. Okay, so for the prevention phase, okay, this is a formula that they have composed and give it to all the patients that are otherwise healthy. And the idea is you want to keep patients healthy if they have certain pre-existing weakness. Okay, so Qi deficiency, blood deficiency, Wei Qi deficiency, and so on. You obviously want to strengthen them as much as possible. But at the same time, we are assuming, right, most of the patient will be exposed to the virus at some point or the other, right? Then what happens is you want the immune system to be strong to fight out the virus, but you also wanted to give it assistance as much as possible. So you prescribe and add some heat-clearing herbs that specifically have antiviral effect. So that's basically how this prevention formula is composed. And later on, as we look at other formulas, it's basically the same idea. You want to have a prevention formula that have two main sets of herbs. One set to tonify Wei Qi, the other set to have some heat-clearing herb that eliminate the toxin. Specific ones, you want to choose one that have antiviral effect. Okay, so as long as you have those two main category of herbs, you will do fine. All right. In this particular case, the first three are basically the herb that tonify Wei Qi. And if you remember the classic formula, right, this is Yu Ping Feng San, the J windscreen powder. So you have Huang Qi, astragalus, Bai Su, atractalotus, and Fang Feng, commonly known as Siler or Sapochkonovia. So this is a classic formula. You can use it as is, or you can compose it from single herb. You can use raw herbs, you can use granules, you can use, however it is, it doesn't matter. The key is ingredients and the proper dosage. And then on top of that, there are two herbs that clear heat and eliminate toxin that have shown good antiviral effect. So one of them is Guanzong, or more specifically, Myanmar Guanzong, which is Dryopteris. Another one is Jin Yin Hua Lanasura flower. Okay, so both of these are good antiviral herbs that in Chinese medicine clear heat and eliminate toxins. Okay, but unfortunately at this point in time, both of these herbs are going to be very hard to get. Myanmar Guanzong is primarily an anti-parasitic herb. Okay, so most people don't carry this herb, because, it's not often that we treat parasites. And Jininhua, most of us know this herb, but what happened is because of a sudden spike in demand, it's going to be very hard to find. Okay, so if you can get them, great. If not, then as we go on today, we'll talk about other herbs that clear heat and eliminate toxin. Look through it, look up, other herbs if you have to. Make sure you use herbs that have antiviral effect. That would be the best case scenario. Okay, and then two other herbs are added. One is Chen Pi, orange peel, and another one is Pei Lan, eupatorium. Chen Pi, you should have no problem. If the herb company runs out of it, you can make your own at home. Get the oranges, dry the peels, and then use it as raw herb. Or if you don't mind, then just eat the peels. Okay, Pei Lan, you might have a hard time finding it. Pei Lan is eupatorium. This herb does contain pyrrolidazine alkaloid, and the alkaloid may cause hepatitis. Okay, so as far as FDA is concerned, this herb is deemed unsafe as a food and also as a dietary supplement. So basically illegal. But most people don't know about it. But personally, so you can still get it. I'm sure there are a lot of herb companies that still carry it. But personally, I wouldn't use it for legal reasons. For medical reasons, I would avoid using this herb in patients that have pre-existing liver problems. Okay, but that aside, overall, once again, the main emphasis for prevention is make sure, okay, you use half of the formula to tonify Wei Qi and half of the formula to clear heat and eliminate toxins. Okay, somebody also asked me about contraindications, so I'll mention that as I go, right? So we mentioned Pei Lan should not be used, especially if patients have pre-existing liver conditions. Huang Qi is a very strong herb that tonifies the immune system. Okay, so I would say in this case, the main caution or contraindication with Huang Qi is if the patient has autoimmune disease or if they are taking immunosuppressants. Okay, obviously for autoimmune disease, their immune system is already hyperactive. Okay, so you don't want to set the immune system on fire and stimulate it any further. Okay, and then the other is if they're taking immune suppressants. These patients could be patients that have gotten an organ transplant. So obviously, the immune system may reject the organ and attack the organ, right? And that's why they take the immune suppressants to keep it in check. And you don't want to use Huang Qi in this case because you may have, this could be theoretical or it could be actual clinical, but you may have a risk of Huang Qi increasing the risk of organ rejection and basically cancel the effect of the immune suppressants. So I think that's probably too much risk to take, okay? So that's what I would keep in mind, all right? These are the acupuncture protocols, basically to max out these points for 10 minutes. obviously one question was raised that, well, if you do moxa and the patient inhaled the moxa, would that make their lung weaker? Okay, so in theory, that could be a concern. And if that's the case, well, then do acupuncture or do acupressure, but once again, be open, be creative. You don't have to follow the exact protocol. All right. So if the disease gets past the initial phase, obviously it then starts to move inward, right? So now you're going to show early signs and symptoms. Okay, so the first one is wind cold, affecting the exterior. Second one is toxic heat attacking the lung. And the third one is damp cold in the lung. These are the three phases within the early phase, according to the Hubei province. So the phase one is wind cold, signs and symptoms. You have fever, aversion to cold, chills, headache, soreness of the muscles, and no sweat. Lung CT is negative, so lung is not affected, it's still exterior. Tongue is pale, white, thin, floating pulse. Okay, treatment plan is to expel wind, release the exterior, clear heat, and eliminate toxins. All right. Herbal formula of choice are Ge Gen Tang Kutsu decoction or Cai Ge Jie Ji Tang, Purpurum and Kutsu decoction to release the exterior. So both of these formula are primarily aimed to treat wind cold affecting the exterior, causing a lot of muscle aches and pain. Okay, so muscle aches and pain is something that can be quite common in the early signs and symptoms among the COVID-19 patients. All right. And if you were to look at Ge Gen Tang, which is one of the main formula in this case, the main ingredients are Ge Gen Puaria, also known as Kutsu, Ma Huang, Ephedra, Guizi, cinnamon twigs, and so on. What happened is these are the herbs that release the exterior, induce sweating, like we all know. And at the same time, they also open up the blood vessels. Okay, so once they open up the blood vessels, more blood will flow to the affected area. You have more hydration. You have more blood cells, white blood cells especially, that go to all different parts, not just the muscles, but also your sinus cavity, your upper respiratory tract, and also your lung. So that enables the white blood cells to fight the virus better. It also opens up the vasoconstriction and hydrates your mucous membrane. So the mucous membrane will help to trap the initial virus that gets in, and hopefully you get rid of it that way. Okay, so what happened is the Ge Gen Tang or Cai Ge Jie Ji Tang, if you look at the original formula as is, they are more of a supportive formula, okay, meaning they support the patient, they support the body. So they help the body to help itself. These herbs, the first few, none of them have any heat clearing effect, none of them have any antiviral effect. So they are not treating the virus itself, right? They are helping the body to help itself. So if the patient is healthy and robust, that's probably enough. But if they have underlying deficiency, they will need all the help they can get, all right? So in that case, you need some heat clearing herb. And that's why you have Jin Lin Hua Lan Isra here. Once again, if you don't have access to Jin Lin Hua, if it's sold out, then you use Lian Qiao for Scythia. You use Ban Lan Gen, Isatus root. You can use Da Qing Ye, Isatus leaf, or many others. Okay, so once again, be open and flexible. One of the things that I noticed about the Western practitioners of herbalism is that they want to know what is the best formula for COVID-19, and they want to use it exactly as is. Okay, and my reply is there's no such thing. There's no one formula that will treat COVID-19. Okay, what we are doing is we're not treating the disease, right? We are treating the patient that has the disease, right? And the patient may have different signs and symptoms that you need to treat differently. Okay, and also depending on the disease progression, they show different signs and symptoms. So you have to be open, you have to be flexible. There's no one size fits all, right? So if the formula you don't have certain ingredients, just look up the herb, see what it does, and see what's the next best herb to use. Okay, so don't panic if the formula is not available. Don't panic if an ingredient is not available. Just do a little research and find out what is the best substitute. Okay, but in this case, keep in mind in the early stage, this formula may be great for treating wind cold at the exterior, but keep in mind that this is generally for patients that are otherwise healthy and robust. Okay, if there are other complications, if they have underlying weakness, you need to make modifications. All right. If the disease, once again, continue to move from exterior to interior, or maybe they have signs and symptoms of both at the same time, then you need to treat both. So this is a case of toxic heat that starts at the exterior and start to move interior. Signs and symptoms are fever, aversion to cold, sore dry throat, dry cough, scanty sputum, right? So they have a little bit, but not a lot. Still sore and painful muscles, weakness, headache. Okay, lung starts to reveal a little bit of cloudy images. So lung is starting to be affected, all right? So they have yellow tongue coating showing some heat. They have floating rapid pulse. Once again, rapid pulse showing some infection, okay? So the key is to treat the exterior, expel wind and release exterior, but also treat the interior, at least have some herbs to clear heat and detoxify at the same time, all right? So the approach is to use yin chao san, honeysuckle, and forsythia powder, and also qingwen baidu san. So that's clear the epidemic and overcome pathogenic influence powder. So in Chao San is more to treat the exterior. Qingwen Baidu San is to treat it as it starts to move interior. And once again, even in China, they don't use the classic formula as is. They modify it if needed. All right. So as you see patients, once again, don't be afraid to modify the formula. Don't be afraid to use a substitute. All right, so in this case, you have Jin, Yin Hua, and Lian Qiao, Lanisra, and Forsythia as your chief ingredients in the Yin Qiao side. Okay, so those are the two most important herbs. These two herbs, as we'll discuss later, in TCM are to clear heat and eliminate toxin, but in Western pharmacology, they have great antibacterial and also antiviral effect, and they are more specific and also stronger as antiviral. Okay, and then another very important herb is Huanglian cactus at the bottom. Okay, Huanglian also have antibacterial and antiviral effect, but in this case, it's stronger as an antibacterial. Okay, so in this case, this is actually a very good formula because historically, let's put aside COVID-19 for a while. Patients that have upper respiratory tract infection, obviously it could be viral or it could be bacterial, right? So a lot of time you don't know. Especially in the early phase. Okay, so if you have a formula that will take care of viral infection and bacterial infection at the same time, then in a way you are casting a wide net, and will treat different infections. So in this particular case, that's definitely the case, right? You have two herbs that are good antiviral, Jinin Hua and Lian Qiao. You also have one herb, Huanglian cactus, that is one of the best heat clearing herb. That's an antibacterial herb. All right, then the next diagnosis is damp cold in the lung in the early phase. Okay, so most of the pathogen is still at the exterior, but what happened is the lung is starting to get affected. There's starting to be some inflammation. There's starting to be some feeling of oppression or stifling sensation or distension or chest stuffiness, okay, but not very severe yet, okay? So once again, we need to start to address that. We mentioned quite a bit that we want to make the diagnosis early. We want to treat the patient before the condition gets worse. So this is the very early indication that the lung is starting to be affected, okay? So you can tell there's greasy tongue coating, there is slippery pulse. Okay, so we want to still treat the exterior to expel wind and release the exterior, but we also want to dispel damp cold at the same time. Okay, so this formula here is more specific for the damp cold in the lung. All right, so to get rid of damp cold, you need to strengthen the spleen, you need to dry the dampness. Okay, so that's why the first few herbs are generally speaking more or less dry and moving and drying the dampness. So you have Changchu, attract lotus. You have Chen Pi, moving the qi, orange peels. You have Houpu, magnolia. You have Cao Guo, fructus Cao Guo, and so on. And at the same time, you have herbs that are releasing, so to release the damp cold from the lung. And that will be Ma Huang, ephedra, Jiang Huo, the top region, and also Sheng Jiang. Okay. Bin Lang is an herb you probably either have it or don't have it, or in most cases you probably don't have it. What happened is Bin Lang, salmon areca, is called the betel nut in layman's language. And what happened is a lot of people in Asia like to chew the betel nut because it's a very stimulating herb. It has what we call the anticholinergic effect. So it's very stimulating. You'll stimulate your cardiovascular system. You will also stimulate your respiratory system. So it does have effect to speed up the metabolism and open up the lung. And in the US, chances are you don't have access to it. And the reason is because for people that chew the betel nuts in Taiwan or Asian countries, what happened is they had noticed an increased risk of cancer associated with chewing betel nuts, okay, especially mouth, tongue, throat cancer, okay. If you were to use this herb as decoction, chances are you will either have no increased risk or much less, okay? But nonetheless, what happened is because of its association with mouth, tongue, and throat cancer, California Proposition 65 deems this herb as carcinogenic, okay? So there's a lot of, Prop 65 warning associated with this herb. So a lot of companies might have decided to not import this herb because it's simply not worth the legal hassle. Okay, so that's the story behind Binlang, okay, what it is, what it does, and why it's in this formula, and also why you are not able to find any of it. All right, so as far as early phase goes, okay, when they start to show early signs and symptoms, these are the acupuncture point recommendations. Okay, once again, the recommendation from the Hubei province is to massage these points for 10 minutes bilaterally. And if you don't want to, or if you don't want to do massage, then somehow stimulate the points one way or the other, acupressure, acupuncture, or, other ways. Okay. And then as the disease continues to move interior, then you start to see pneumonia signs and symptoms. In the beginning, you'll have Shaoyang syndrome with damp, then damp heat affecting the lung, toxic heat, or toxic stagnation obstructing the lung, and eventually closed interior and abandoned exterior syndrome. So pneumonia phase with Shaoyang, signs and symptoms, and dampness. Okay, so once again, how you interpret Shaoyang in this case is as the virus gets into the lung, and it literally gets into the lung cells. The virus actually does that. They multiply, they are released, they get into more lung cells, they multiply. So what happens is they affect not only the lung function, they trigger the body to start to hyperreact, or the immune system to hyperreact, and once again start to damage the lung cells, the linings, and so on. So once again, the fever, the inflammation, the infection itself is a young stage. But once the lung linings and air sacs are damaged, that's the yin. So anytime you start to see that, okay, that's your Shaoyang syndrome, where it's exterior and interior. There's heat and there's insufficiency, which is cold, basically all at the same time. And then damp, of course, refers to the deep level of inflammation, of obstruction, of the proteinaceous plugs and discharge, all at the deep levels of the lung. Okay, CT scan obviously shows the lung to be affected. Okay, red tongue is the heat and inflammation. Thick and greasy tongue coating is the damp and phlegm. And then the slippery rapid pulse is obviously the infection and also the inflammation. All right, so we need to harmonize Shaoyang syndrome and also clear the damp heat. And this treatment is a combination of 3 formulas together. Xiao Cai Hu Tang minor bupropion decoction, plus Sanren Tang 3-nut decoction, plus Gan Lu Xiao Du Yin, sweet dew special pill to eliminate toxin. So Xiao Cai Hu Tang obviously is to treat the Shaoyang syndrome. Sanren Tang Zhen is a nut or the seed. This is a nut or seed to help to get rid of phlegm. And then Gan Lu Xiao Du Yin, anytime you say Xiao Du, Du is a toxin, right? Anytime you eliminate the toxin, toxin is referring to the byproduct of the infection, basically the pus, the abscess, the mucus, the discharge, and so on. Okay, so that is a sputum that the patient may cough out, or it may be the plug or the protein discharge or the hypergrowth of the lung cell that's deep inside the lung that they cannot quite cough out. Okay, so basically you need to treat Shaoyang, exterior and interior, get rid of the phlegm and get rid of the toxins. Okay, and this is how the formula is composed. So the main 4 herbs, or the main herbs for Shaoyang syndrome are Cai Hu bupropion, Huang Qin scutellaria, Ban Xia Panelia. Okay, so these are the 3 main herbs in Xiao Cai Hu Tang. Okay, so you'll see this over and over again in many formulas. Then the seeds are the semen, the fructose, and the semen, right? You have Ku Xing Ren, semen ammoniaca. You have Bai Dou Kou, fructose almond, and also Yi Zhen, semen coices. So these are the seeds or the nuts that's able to loosen up the phlegm and help the patient to cough it out and get rid of the deep-seated inflammation and the plug. Okay, and lastly, you have some herb to clear heat, 华石, tufuling, and so on. Tufuling is another herb that clears heat and eliminate toxin that has good antiviral effects. So once again, if Myanmar, Guangdong, if Jininhua is not available, tufuling, Smilax is also a good option. Somebody also asked me about the safety concern with talcum, 华石. And my reply is, well, in theory, this is a mineral that's mined from earth, and it may also contain a small amount of asbestos. But what happened is they are also pharmaceutical grade of 华石 that's completely free from asbestos. All right, so if you do decide to use this herb, make sure you check with the supplier to make sure they have the test to show that it's free from asbestos. Otherwise, you may be looking at legal mess, sometime down the line if they end up with some kind of cancer. All right, next one is DAMP affecting the lung. So once again, like we mentioned quite a bit already, DAMP is the inflammation, is the phlegm, is the plug, that's deep inside the lung. Heat generally refers to the infection and inflammation. Also, when DAMP is used, generally that means the infection or inflammation is generally speaking isolated to one organ. So in this case, it's isolated to the lung. Okay, so you can see the signs and symptoms, right? Low-grade fever, absence of fever, dry cough, a little bit of sputum, not too much. You can't see it from this particular symptom, but the patient will have chest stuffiness, epigastric distension. They will have greasy tongue coating, slippery paws, and if they do CT, it will show cloudy ground glass opacity. All right, so now those are your signs and symptoms that there's DAMP in the lung. So once again, treatment, you need to transform the dampness, eliminate the toxins, and also disperse the lung and expel the pathogens. Okay, so the treatment plan is to use Ma Xing Yi Gan Tang, which is ephedra, apricot kernel, coices, and licorice decoction. This is a great formula to get rid of damp and phlegm in the lung, but at the same time, open up the airway, right? Whenever you have damp and phlegm in the lung, it's obviously going to affect breathing. And the best herb to open up the airway is Ma Huang ephedra. There is really no substitute that's equivalent. And then at the same time, you want to lower the lung qi, so apricot seed or Kuxingren is used. And then cinnamon coices and licorice is to help to get rid of the phlegm. Okay, and then the second formula is Xiao Xian Xiong Tang, sinking into the lung decoction. So this is a formula from Sang Han Lun, in which as the disease moves from the exterior to the interior, is to describe to possibly sink right into the lung. So basically, this is a point where the patient has lung infection. So it could be bronchitis, it could be pneumonia. So this is a formula specifically used to treat as that happens. And then 草果知母汤, 草果 and Anemarina decoction. This is also to get rid of the phlegm and also clear deficiency heat. So as they combine the three herbs and modify it, this is what we end up with. Okay, so the first few herbs, like we mentioned, are the Ma Xing Yi Gan Tang, which is great to treat the lung damp heat. Okay, you have Ma Huang, Xingren, and Yi Zhen, ephedra, armeniaca, and coices. Okay, and then Huanglian and Banxia, especially Huanglian, is to treat the lung infection. So like we mentioned, okay, Huanglian is a great herb to treat heat in the interior. It's also a great herb for infection, right? It's one of the best antibacterial herbs, okay? And then 草果知母 is to get rid of phlegm and also clear deficiency heat. And here we go, we have one more herb with great antiviral effect that belongs in the category of clear heat and eliminate toxins. So that's 鱼腥草 Hutanania. Okay, so once again, there are many herbs that serve the same function. If one happens to not be available, there are others that you can use. Okay, and I think I saw that Cynthia had a question. So I don't know how she can communicate the question to me, or she raised her hand. Okay, so I stop for a second, see if somehow I can communicate with her. And if not, we'll just keep moving. And for those of you that are listening, if you have a question, once again, please write it down first and then send it either to Cynthia or send it to me. And if we have time, we'll get to it at the end of class. If not, I'll receive all the questions. I'll write it up. I'll write down my reply, and then we'll find a way to get back to you. As long as they have your email address, then we should be able to do that. Okay, there are some questions regarding ibuprofen and so on. And if you don't mind, what I'm going to do is, as you give me the questions, I will try to answer questions that are strictly related to TCM. And the reason is because I think that's my expertise, and that's an area where I can help most of you the most. Okay, and that we can also make the best of the time. If you have a question about ibuprofen, then what happens is you can Google, you can find out the answer fairly easily online, okay? Or we can discuss it, in a different form. But we have limited time. We are an hour and 15 minutes into this, so I want to make the best use of my time. So anyways, what I'm gonna do is I'm just gonna proceed, okay? And finish the class, and we should have 10, 15 minutes to answer questions at the end. Okay, so I think that will help the class to flow a lot better. All right, so pneumonia phase, this is toxic stagnation obstructing the lung. So once again, anytime you see toxic or toxin, this is describing the byproduct of infection and inflammation. So once again, you will start to see abscess, sores, discharge, mucus, those type of things, okay? In this case, even though that's there, you may or may not see it because once again, it's very deep inside the lung. Okay, so signs and symptoms are cough, stifling sensation, distension in the chest, asthma, wheezing, accelerated respiration, and so on and so forth. Lung is affected based on CT scan. You have dark purplish tongue, right? So the lung is getting less and less oxygen. You also have fibrotic changes, all right? So when you have fibrotic changes, that means the lung that used to be very soft like a sponge is starting to have fibrosis. Okay, that means the lung is getting stiffer and stiffer. It's having knots, it's having thick tissues. And that's a bad sign because that means the lung is no longer able to do its function. Okay, at least this is an early sign. So that fibrotic change or fibrosis in the early stage is the formation of the nodules or the phlegm accumulation. But once it becomes permanent, then it becomes blood stasis. All right. So if you know the patient who have fibrosis of the lung, so that would be early stage phlegm in the lung, later stage blood stasis. If they have fibrosis of the liver, so once again, that's early stage phlegm in the liver, later stage blood stasis in the liver. So that's how TCM would interpret fibrosis in the early to later stage. Okay. Once again, you have greasy tongue coating and slippery paws, indicating there's some damp and phlegm underneath the condition. All right, we need to detoxify, arrest wheezing, transform blood stasis, and open up the collaterals. Okay, the formula in this case is a formula called 白虎加人参汤 plus 四土汤. So 白虎加人参汤 is a formula called white tiger decoction plus rensen, and this is primarily used to treat the lung heat with somebody who has some underlying qi deficiency. 四土汤 is 4 wild decoction, and this is a formula most of us are probably not familiar with, but this is to help to eliminate the toxins. All right, so 白虎汤 is used here for the severe lung heat and lung toxins. So 石膏 and 知母, gypsum and erniemarina are two of the very cold herbs that help to cool the heat. Okay, and though the formula is called 白虎加人参, which is the Chinese or Panax ginseng, in this case, 西洋参 is used. 西洋参 is American ginseng. And that's actually a very good choice because obviously the patient already has a lot of heat. You don't want to use a hot herb to make it worse. Okay, so generally speaking, 党参 Cotonopsis would be a good choice. 西洋参 American ginseng would be an even better choice because 西洋参 will also tonify qi, but at the same time, it's cool in property and it's nourishing in nature. So it will help to nourish the underlying blood, or underlying indeficiency. Okay, and then you have some herbs that have heat clearing effect. So once again, 土茯苓 Smilax, It's an herb that clear heat and eliminate toxin. It also have antiviral effect. So once again, there are many herbs that you can choose from as far as antiviral herbs goes. Okay, and then the 四土 tang, 四土 refers to 4 herbs that have 土 tu in the name, right? So you have 土茯苓, you have 土大黄, you have 土贝母, and 土牛膝. So these are the herbs that clear heat, that move the blood, and drain the toxins. Okay, and then at the end, you have a lot of herbs that also move the qi, and also seeds that help to get rid of the phlegm, right? So you have mainly 2 herbs, 来附子 Semen raphanus, so this is help to get rid of the phlegm, and then ting li zi, which is the scuronium or lepidum. And ting li zi is generally an herb we don't use a lot, and the reason is because even though it has a very good effect to treat the very damp and hard and stubborn phlegm that's hard to get out, it also consumes qi quite a bit. Okay, so unless you have to, generally we don't use it. But if you have phlegm that's very hard to cough out and that's very deep in the lung, then it becomes the most important and most potent herb to use. Okay, but make sure you use it in patient that doesn't have a lot of underlying qi deficiency. All right. And the last phase in this case is a closed interior, abandoned exterior syndrome. So in this case, the patient is basically having cytokine storm, is not getting any oxygen, and starting to have multiple organ failure. All right. So they are losing their consciousness, and all their organs are starting to fail. All right. So in this case, you need to use herbs that resuscitate the lung and resuscitate the heart. So that's where 四逆加人参汤 comes in. And then you combine it with 安宫牛黄丸 and 止血散. Both of those are the resuscitating formulas. And I don't want to go any further into this. And the reason is because it's only for academic purposes. These formulas are, as far as I know, nowhere to be found in the US because many of the ingredients are not available here in the US. And at the same time, as an acupuncturist, are you really going to go into ICU as the patient is getting life support to treat them with 安宫牛黄丸 and 止血散? Chances are that's not going to happen. Okay, so this is an option, just know it, but most likely you're not going to be using it in clinical settings. All right, so now we are recovery phase. If the patients are recovering, if they're going to get discharged from the hospital, then great. This is all what we're looking for. But Western medicine just sends the patient home. I think we can do a lot better. So as these patients leave the hospital, they have the inflammation, they have the virus that have attacked them. They are treated with a lot of Western drugs, whether it's antiviral or antibiotic, that tends to be very bitter and cold. So basically the disease and the drug have attacked the patient, and they end up with a lot of qi deficiency, insufficiency, lung and spleen, stomach all get damaged. So ideally, you nourish in, you tonify qi, and you treat the lung and the spleen deficiency. The best formula to use is Saxe, 麦门冬汤 Galenia, or Ophiopogonus decoction. This formula is slightly modified, but the bottom line is the 2 most important herbs are Saxe, Galenia, or Adenophora. One is Nan-Sasen, one is Bei-Sasen, and also 麦门冬 Ophiopogonus. So those are the 2 main herbs. You can use Rensen, which is the Chinese or Korean ginseng. You can use Xiyangsen. Either way will be fine. If the patient doesn't show any more signs and symptoms or heat, then you can modify it, and you don't need Huangqin, Scutalaria at the end because they may be very deficient already. So Huangqin may or may not be necessary. But anyways, if you go the direction to tonify qi and nourish in these patients that are discharged, you will be fine. Okay? And these are the acupuncture protocols. Okay, so if you look through the whole thing, if you think back through the whole thing, right? Once again, the approach is start from the exterior to the interior. Okay, and the 4 phases are prevention for patients that are otherwise healthy, early phase for people that show the initial signs and symptoms, pneumonia phase when they show the lung signs and symptoms, and then treat the lung deficiency, insufficiency as they are discharged, right? So keep those 4 phases in mind. And it's not so complicated. It's not so scary, right? If you know where the patient come from and where they're going. And once you have the big picture, hopefully you know exactly what to do when you do see those patients. Okay, and to drive that point home, let's now look at the Wuhan Union Hospital of China and what their protocol is. Okay, so they didn't quite say there are 4 phases, but rather they divided into 7. But if you put them into 4, basically it's the same, right? You have the prevention phase, that's the initial part. Then you have the wind heat and early stage wind damp warmth. So that's the early part when the disease is exterior or starting to slightly affect the interior. And then you have the lung phase or pneumonia phase, and that's primarily damp heat obstructing the lung, epidemic toxin blocking the lung or closed interior and abandoned exterior. So those 3 are mostly the pneumonia phase. And the last 2 is also exactly the same: insufficiency of qi and yin, deficiency of spleen and stomach. Okay, so once again, it's slightly different, but the main idea is the same. Okay, it goes from exterior to interior. It goes from the upper respiratory tract to the lung. All right, and now let's look at the prevention. So once again, the prevention is also very similar to the Hubei province treatment protocol. The first 3 herbs are exactly the same, right? You have Huangqi, astragalus, Baisu, atragalotus, and Huangfeng, Siler, or Sapochnikovia. So once again, this is the classic formula, Yu Ping Feng San, right, to tonify qi. And at the same time, assuming once again, all patients will be exposed to coronavirus at some time, you also want to use some herbs that have antiviral effect that belongs in the category of treating with heat, eliminate heat and clearing toxins. All right, so Wuhan in this case is a little bit more aggressive. They use quite a few. So they use Myanmar, Guangzhou, Dryopteris. They use Lan Kao, Forsythia. They use Yuxing, Chahutanenia. So they don't just use 1, they in fact use 3, right? And then finally, a lot of the COVID-19 patients, well, not a lot, 5 to 10%, may also show GI signs and symptoms. Okay, so at the end, Guang Huoxiang or Huoxiang, either Augustachi or Pogostemona are used to help to treat the GI signs and symptoms. Okay, or you can use the classic formula Huoxiang Zheng Qi San. So that's the Pogostemona formula or Augustachi formula to rectify the qi. So once again, for prevention, the main goal is you want to have half emphasis to tonify away qi, strengthen the immune system, half emphasis to clear heat and eliminate toxin, and treat the virus. All right. So once you're able to strengthen the body and fight the virus, regardless of how you put it together, it should work very well. Okay. Early stage of wind heat invading the exterior. So once again, you have a lot of generic signs and symptoms such as headache, sore throat, dry cough, thick tongue coating, red tongue tip, and so on. So mainly you want to use herbs that treat wind heat. So once again, the main herbs are the same. 2 most important herbs in this early stage are Jin Yin Hua, Lanesra flower, and Lan Kao, Forsythia. And once again, like we mentioned, they clear heat, eliminate toxin. They have some antibacterial effect, but primarily they're antiviral. Okay. What you'll notice if you look at the herb further is that Wuhan is more aggressive in treating these patients. So even though the disease is at the exterior, they treat the exterior, but they also start at the interior as well. You know, they don't want the disease to go any further. So that's why if you look at the herbs further, you'll see Caihu, Populorum, Huangqin, Scutellaria, and also Banxia, Penalia, right? So these are the 3 main herbs that's in Xiao, Caihu, Tang, minor Populorum decoction. So they're assuming that the disease has a very good chance to move interior. So they want to get a head start and start to treat it that way. And then they add in another herb called Ban Lan Gen, Isatus root, right? So it's another great herb with great antibacterial and antiviral effect. And we'll talk about this herb more as we go. But in any case, my point is Wuhan is more aggressive. You know, not only do they treat the exterior when the patient showed those signs and symptoms, they start to treat the interior as well. Okay, damp warmth in the early phase. So once again, damp is the infection that's starting to show up in the lung. Warmth is the same as heat, just not as severe. Okay, so with that diagnosis, you need to have something to clear the warmth and clear the heat and also dry the damp. Okay, so once again, Jin Yin Hua and Lan Kao, Lanesra flower and Forsythia fruit to treat the exterior wind heat or the warmth that's still present. Okay, and then you also have Huangqin, Scutellaria at the end to treat the heat that might move inward. You also have Huoxiang, Pogostemon, if the patient has GI signs and symptoms. You also have Caihu, Populorum. You also have Huangqin, Scutellaria, and Banxia, Penalia once again, they are assuming that the disease may move interior, so they have the composition of Xiao Cai Hu Tang, right? So again, like we mentioned, Wuhan is more aggressive. They probably see this first, and they see how severe it is, so they are treating the TCM diagnosis as they see it. They are also preventing the disease from getting worse. Okay, another interesting herb that I see here is an herb called Hongjingtian rhodiola. And this herb, prior to COVID-19, the only time I see it used is for people that go visit Tibet, okay, or people that try to climb Himalayas. And this is the best herb to use for people to adapt to altitude sickness. Okay, so basically to help their body to adapt to lack of oxygen in their system. Okay, so this is probably why, patients that have COVID-19, when their lungs start to get affected, obviously a lot of them end up with respirators and ventilators. So this is basically, think of it as the herb respirator or ventilator, either to help the patient adapt to that better, or maybe in fact help to get more oxygen into their lung. So from a pharmacological perspective, I don't quite know, but that's the clinical application for that herb. Okay, damp heat obstructing the lung. Once again, this is dampness, okay, and heat. So we need to treat both at the same time. Okay, the formula once again is somewhat on the aggressive side. You have Chuan Bei Mu, Sang Bai Pi that help to treat the damp. You have Yu Xing Cao and Lian Qiao that clear heat and eliminate toxins. So they have the antiviral effect. You have a lot of the seeds in this formula, right? And the seeds, generally speaking, in this case, are very good to get rid of the phlegm and the lung that's deep inside the body. In this case, these are the seeds that help to loosen it up first, right? So you have Yi Yi Zhen sementicosis, you have Mai Men Dong Ophiopogonus, you have Dong Gua Zhen Benicassa, you have Ku Xing Zhen bitter apricot seed, and then Jie Geng is the one that brings it upwards. Okay, and then you have Tai Hu, Huang Qin, and probably Ban Xia somewhere too. Anyway, so Tai Hu and Huang Qin are the key herbs in Xiao Cai Hu Tang. Okay, and then Hong Jing Tian is to help the patient adapt to the lack of oxygen. And Bin Lang, like we mentioned earlier, is an herb that stimulates the heart and dilates the lung, so help to speed up the metabolism and so on. So this is how the formula is composed. Okay, and then finally, if you have epidemic toxin blocking the lung, this is discussing the more severe condition in which the patient has a lot of trouble breathing, a lot of trouble getting enough oxygen, so they end up with severe hypoxia. So they become dark complexion, they start to have dark red tongue, and so on. Okay, so in that case, once again, you use Ting Li Zi as a last resort to go in and try to get rid of the very deep-rooted phlegm that the body cannot cough out. And then once again, a lot of the seeds, yes, Yi Yi Zhen, sementicosis, Dong Gua Zhen, Benicassa, Tao Zhen, and so on. And if those herbs are not available, there's a great formula too called, I'm blanking out for a second. Anyways, I'm blanking out for a second. If I think of it, I'll let you know as we go on. It'll probably pop in my head, but it's a formula for treating heart phlegm in the lung. Okay, and then you also have a lot of herbs that have heat clearing and antiviral effect. So that's Yu Xing Cao, Huttanania, Jin Yin Hua, Lanesra, and also Forsythia, which is Lian Qiao. Okay, and then finally, the worst case scenario again is closed interior and abandoned exterior. So once again, this is when the organs start to fail and the patient really need life support. Okay, treatment is basically the same as the Hubei provincial approach. Basically, 四逆加人参汤 with 附子, aconite, and 人参 ginseng, along with herbs that have resuscitating functions, such as Angong, Huangwan. And in fact, Wuhan is more aggressive. They even will use herbs through injection. Okay, so Senfu injection refers to Rensen and Fuzi, which is a Panax ginseng and aconite in injectable form. Okay, and Sengmai injection refers to Sengmai San, which is generated pulse powder. Okay, so this is something that they do in China, but unfortunately we cannot do it here. In fact, the very first time I went to intern in China was 1990. Okay, and I was at Guang'anmen Hospital, and this is a long time ago, 1990, right? And I remember when I was interning, I saw the very first order that just dropped me to the floor. What I saw was Huang Qi IV drip. Huang Qi is astragalus. And at the time, I never thought I would see those two words in the same sentence. But now, some 20, 30 years later, it's actually very common. China is very aggressive and very integrative in terms of integrating and bringing both TCM and Western medicine together. All right. Anyhow, as a patient are discharged from the hospital, once again, the TCM diagnosis is the same, mainly Qi and Yin deficiency, spleen and stomach deficiency. So formula is also more or less the same. You have Sa, Sen, either Nan Sa Sen or Bei Sa Sen, right? So you have glenia and adenophora, and also Mai Dong, which is Mai Men Dong, and those are your two main herbs. And then you have Tian Hua Fen and Xi Yang Sen, trichosanthus root, and also American ginseng that help to nourish fluids, generate fluid and nourish yin. So, and again, anyways, you can use these herbs as is. You can use the classic formula. Any of those approach would be fine. Once again, as long as you go that same direction. Somebody also asked why I put Dilong in here, or what's the function of Dilong in here. Dilong is earthworm or Ferritima is a great herb to relax the lung or to block the lung from having bronchial constriction. So it's generally or commonly used as a replacement or substitute for Ma Huang, ephedra, should Ma Huang not be available. Okay, so that's probably why. And then Ma Huang is probably too warm and too stimulating in these discharged patients. So if they have a little bit of wheezing and dyspnea and shortness of breath, they don't quite need Ma Huang, then Dilong will be just fine. All right, so that's the Hubei approach and also Wuhan approach. And the last one is the PPRC guidance. Okay, so this is the official guidance. Like I mentioned, the 6th edition is English, 7th edition is Chinese. Well, the 7th edition is only a slide edition. Okay, so I think for the English-speaking people, the 6th edition that's English is the best choice. Okay, and it's about 200 pages or so. It roughly broke the TCM treatment of COVID-19 into 3 phases: medical observation, clinical treatment period, and also recovery phase. And then these are the specific breakdown within the last 2 phases, okay? I won't go into detail in this case, and the reason is because this book is very integrative, so in addition to the last phase, like we discussed earlier, where they use injection, they use a lot of injection in different phases, okay? They also use a lot of pattern medicine in different phases. And I don't want to get into detail because number one, those patents are just not available. And also a lot of the patents from mainland China, they do combine herb and drug at the same time. So even if you can get it, legally speaking, you cannot prescribe it because we are not licensed to practice drug medicine, okay? And also we cannot use injections. But nonetheless, what happened is, once again, the main categories are the same. Medical observation period is when they have the early signs and symptoms. Clinical treatment period is when they have the pneumonia itself, and recovery period is the end. But what also happened is, as they see more and more patients, right? This is what the waiting room looked like in the clinic, okay? And then at the end, those three characters you see is 抢救室, which is ICU, right? You have all these patients that are waiting to be seen in ICU. And at the same time, we all heard about the story of China building a hospital in 10 days. Well, actually, they built 2, right? So with this many patients, there's no way they can do customized prescriptions. So in the end, what happened is they end up with a formula on a national level that they are trying to push and get all the people to take. And this is the formula that they came up with called 清惠排毒汤, clear the lung and eliminate toxin decoction. So this is the PPRC recommendation for all the healthcare workers to take, okay, to protect themselves, and all the patients to take when they are in the medical observation period. And this formula is basically a composition of 4 formulas. The first one is 麻杏甘石汤. So this is a formula for treating patients with wheezing and dyspnea due to lung heat. So Ma Huang is to open up the lung. Xingren is apricot kernel to direct the qi downwards. Gan Cao is licorice, and that is to harmonize the formula and also reduce the inflammation. And Sigao gypsum is to clear the heat. xiao cai hu tang, minor pleural decoction, is once again assuming that the disease will move interior. So you want to harmonize sao yang and treat the exterior and interior at the same time. And then se gan, ma huang tang, bialang kanda, and ephedra decoction is to treat the type of lung heat that also have severe sticky lung phlegm. So very similar to the description of COVID-19 for the deep level of inflammation in the air sacs. And finally, Wu Ling San, 5-ingredient powder with poria, and this is to reduce and drain the accumulation. Okay, so that is how this formula Qing Fei Pai Du Tang is composed. This is the instruction to take the decoction and modification of Sigao dosage. Okay, and this is the data that the PPRC then disclosed, that out of 701 patients in 10 provinces that took this formula, 130 recover and are discharged, 51 had resolution of signs and symptoms, 268 had improvement, 212 had stabilization. So all these patients are considered to have benefit from the formula. So their conclusion is the formula is 94.3% rate of effectiveness. Okay, so take it for what it's worth. This is the data that came out from China. I do believe the formula is effective. It's a very well-constructed formula. The drawback is I feel it's a little bit too aggressive. It's a little bit too early to give to all the medical workers that work in the hospital, and a little bit too aggressive and too early for the patient that show early signs and symptoms. Okay, so I think there are better approaches. Doesn't have to be so aggressive. But like I mentioned, what happened is they are seeing so many patients, thousands and thousands of patients and medical workers. There's no way to come up with differential diagnosis and customized treatment. So this is what they found to be the best compromise to give to everybody. Okay, and the challenge we have here in the US is, number one, ma huang is generally speaking not available. FDA deems this herb to not be a food and not a dietary supplement. So legally speaking, there's no room for it to exist except in as a drug. I won't get into the details, but there is some way to get it and there's some way to use it. Okay, that's another topic for another day. But overall, ma huang works well because it has ephedrine alkaloids. A lot of people ask whether Mormon tea will work or not. What happened is Mormon tea is ephedra nevadensis, but it does not contain any ephedrine alkaloids. So I have never used it personally, but my guess is it's not going to be effective to dilate your lung. Okay, so from a Chinese herb perspective, the possibility as substitute include Dilong, Ferritima, and like we mentioned, Dilong is a great herb to also prevent the lung from getting worse if they are having asthma type of problems. So it doesn't have a direct effect to dilate the lung like ma huang does, but it does have an effect to indirectly prevent the lung from further constriction. So its effect is indirect, it's slower, it's not as potent, but it's one of the few substitutes that seems to work decently. Then you also have Ku Xingren, which is a bitter apricot seed that direct the qi downwards, okay? So they don't have cough and wheezing and asthma. And also Zi Su Zi, fructus perola. Dosage-wise, follow the normal dosage, you'll be fine. And if you're aggressive, then go toward the higher end of the dosage range from what you see in the material medicals. Another herb that's generally not available is xixin, and the reason is because it has aristolochic acid. Aristolochic acid has been found to be a nephrotoxin and also carcinogen, meaning it's toxic to the kidney and may also cause cancer. Okay, so FDA has also prohibited the use of this herb, but that's another topic for another day. Okay, so in this country, what happened is it's not available. Then your best choices are Jianghuo, Naphtapterygium, or Fangfeng, Saponicovia, to dispel exterior wind cold. And if you're using this herb to warm the interior, okay, to help to get rid of phlegm, then larger dose of ganjiang, dry ginger, and baijiezi, which is synapses seed or mustard seed, are your next best choices. And once again, they are not as strong. All four of these herbs are not as strong. So you do need the higher dose within the dosage range, okay? And also none of the herb does both functions at the same time. So you do have to combine at least one from each subsection in order to mimic the complete effect. And then another herb that's technically speaking not available is Guangdong Hua, which is Floss, Fafara, or Tosaligo. And the reason is because it contains pyrrolidazine alkaloid. And pyrrolidazine alkaloid may be toxic to the liver. So once again, according to the FDA, it's not a herb, it's not suitable as a dietary supplement because of the toxicity. So really you should not use it. But a lot of people still are able to import it and use it. And the reason is because even the FDA probably doesn't know that the herb contains pyrrolidazine alkaloid. But if you do use it, then make sure you don't use it in patients that have pre-existing liver condition. Much like the previous slide, somebody told me that they can still get xixin asarum. And my response is, yeah, if you have it, you can use it. You know, it has very, very little erythrocyclic acid. So theoretically, it's toxic. Clinically, probably not. But if the patient ever have renal problems, then you're going to have a very hard time explaining why you use that herb in court. Okay. Anyways, with Guangdong Hua, the replacement would be Ku Xing Ren. Once again, the apricot seed, Ziwan Asteris, and also Zisu Zi Perla. Okay. In this case, normal dose will be fine. You don't need to go any higher than that. All right. So overall, I hope by this time you have a very good idea, you have a good picture in your head what COVID-19 disease look like, right? You start from healthy patient, which hopefully most of you still are, to early stage when they have early, headache, chills, fever, sore throat, dry cough, a little bit of dyspnea, maybe some GI symptoms. So those you can use in Chaoshan herbs to treat it. Oh, anyway, let me do the big picture. So if they have those, then you can use herb to treat the early or the taiyang or the wei phase of problem. If it goes into the lung, then it's a pneumonia phase, and finally, as they are discharged, it's recovery phase. So I hope by this time you have a good idea of what the disease pattern looks like and what you need to do to treat these patients. Specific protocol is going to be a little bit different, but the big picture is the same. So hopefully I'm able to paint a good big picture so you know where we are going. It may not be a GPS instruction of where you need to go, but hopefully you have a big idea of what you need to do. Okay, and if I have done that, then I think overall that's good. And if you want to go deeper and compare all the formulas, then this is a chart that's put together by Loy Shu, and basically listing out the 3 treatment protocols, different phases, okay, and generally what formula and what the specific compositions of the herbs are. So once again, if certain formula is not available, if certain herb is sold out, or certain herb is contraindicated, hopefully by now you also have an idea of what formula to use as a substitute or what other herb to use as a replacement. And also I mentioned quite a bit what contraindication certain herb may have, so in case if you encounter those patients, you are flexible, open enough to modify the formula. And if you know that, then I have done my job. And that's what this seminar is really for. If you are an acupuncturist, you want to do acupuncture, this is the Journal of Chinese Medicine. They have a study on a slightly different protocol on acupuncture treatment for COVID-19. All right, so let's take a few minutes now to look at the research aspect, okay? I do this because I'm very interested in studying the pharmacology and research of the herbs and formulas. And also, I think personally, this is really the only way to communicate with medical doctors, pharmacists, and nurses, because my experience has been that if you speak the TCM language to them, okay, you'll lose them very quickly. If you say yin, you have to wait and look at your watch, and 10 minutes later say yang. Otherwise, you'll lose the audience. It's going to go right over your head. Damn Pete or damn Co really means nothing to them. Okay, so to get them to work with us, or for us to work with them, you need to speak their language, and that is pharmacology, clinical research, clinical studies. So let's look at some quickly pharmacological research of single herb. Some we know, some we don't know, and also herbal formulas. So Huangqi, I'm sure is an herb that all of us know already. It's a great herb to tonify qi, to raise yang, but in this particular case, we are most interested in its effect to tonify wei qi, and basically wei qi is your immune system, okay? And from a study perspective, this herb has a great effect to stimulate the immune system. So use of the herb is associated with promotion and generation of T cells, and also the polysaccharides, which is the main ingredient in the herb, has been shown to activate the B cells. And what that means is T cell is basically your first line of immune response. It's also known as a non-specific or innate immunity, all right? So this is the first line in which a T cell will fight against the virus, will help to gobble up, eat up, destroy the virus, okay? And then what happens is B cell is activated. B cell is a specific immune system. So B cell will remember what the virus looked like, whether it's a herpes virus or corona, SARS virus, or whatever virus or whatever pathogen. You will remember it, you will have antibodies, and this is where you are then cured of the infection. It's much like chickenpox. Everybody will be infected with chickenpox probably one time you're exposed to it, but very few people will get second infection. And the reason is because your B cells remember what the virus looks like. So if you're exposed to the second time, they will get rid of it before you will have any signs and symptoms. So Huangqi astragalus is able to do both. You were able to stimulate your T cells, non-specific immunity, and also activate your B cells, your specific immunity. So it's good for both short-term and long-term protection, okay? And then what happened is we talk about a lot of herbs that clear heat and eliminate toxins. So some of the herb we know and some of the herb you may not. Let's quickly talk about them, right? So Jininhua clears heat and eliminate toxins. So historically, like we mentioned, it has some antibacterial effect, but mainly it's a very good, very strong antiviral effect. So these are the antibacterial examples. These are the antiviral examples, right? So it treats, in fact, quite a few different viruses. Antiviral activity against influenza virus, Coxsackie virus, okay? And the effect is inhibitory effect, specifically against SARS coronavirus. This is a study that looked at 21 herbs and their antiviral effect. And what they found is that among the 21 herbs and different viruses, including herpes simplex virus, respiratory virus, SARS coronavirus, and so on, they found Jininhua to be very effective to inhibit the SARS coronavirus replication and non-toxic concentrations, okay? And that's important because some of the herbs work, but only at very high concentrations. And that's not very helpful because if it requires such high concentration, then the higher the dose, the more toxic it may become. Or maybe the toxic concentration needs to be so high, you need to do it through injection. So that's not very effective either. So Jininhua has been shown to inhibit SARS coronavirus replication at the therapeutic dose, all right? Another herb that's very effective is Banlangen isatus root. So once again, the TCM description is to clear heat and eliminate toxins. It has antibacterial and antiviral effect, and I would say the two is about the same. But another very distinct function of this herb is the antitoxin function. And what that means is it's actually able to suppress the inflammatory response or the hyperinflammatory response that sometimes happens as you are treating bacterial and viral reaction. So what happens is as the bacteria are killed, the lipopolysaccharides from the cell wall disintegrates or scatter everywhere. And same thing with the virus. As the virus are killed, the viral particles of the genetic material scatter everywhere. Then what happens, the immune system overreact and triggers hyperinflammation. So antitoxin and anti-inflammation in this case means in addition to treating the bacterial and viral infection, it's also able to suppress and keep in check the hyperinflammatory response. So that is very benefit in terms of cytokine storm prevention, okay, in which there is hyperinflammation, all right? So this is the antiviral description of Banlangen isatus root. It works, or it shows antiviral effect against various influenza virus, avian influenza virus, swine influenza virus, adenovirus, herpes virus, pseudovirus, Coxsackie virus, cytomegalovirus, and so on. So it's a great herb with many antiviral effects. Specifically in this study, in this research, this is anti-SARS coronavirus, blah, 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 the effect about the herb. And what they found is that the herb, Isagus indigo root, which is banlangen, and its compound, okay, has a direct effect to inhibit the enzymatic activity of the SARS coronavirus. Okay, so not only is it good against some of those viruses that we mentioned earlier, it's also effective against this particular coronavirus. Well, actually, this is a SARS-CoV-1, not a SARS-CoV-2. And then you have Yuxingcao houtenania. This is, again, once an herb that clears heat and eliminates toxin. So you probably notice by now that what happened is heat clearing herb is a very large category, right? So what happened is many herbs clear heat and eliminate toxins. If you know the herb belongs in that category, that's great. You're going the right direction. But what happened is if you study the pharmacology of herb, then what happened is you can get more precise as far as which herb you want to prescribe. Because some herbs that clear heat and eliminate toxins have antibacterial effect. Some have antiviral effect. And if you get more specific, you can pin down which bacteria and which virus. And in that case, you get even better effect because you prescribe an even more precise herbal formula. So Yuxingcao is another great herb to treat bacterial and viral infection, but it's once again more specific for virus infection. In fact, the antivirus effect is described as antiviral and also virucidal. So antiviral generally means it inhibits the viral replication, and virucidal means it actually kills the virus itself. So this herb is effective against herpes virus, a cyclovir-resistant herpes virus. A cyclovir is Zovirac, one of the very few antiviral infections. H1N1 virus, pseudorabies virus, influenza virus, and also HIV virus. And then specifically, Yuxingcao has two main effects against SARS coronavirus. One is immunomodulatory, and the other one is specifically inhibitory. So in this case, the water extract of Yuxingcao demonstrates antiviral effect to inhibit the virus and also to increase the proliferation of the lymphocytes. So that's your white blood cells to fight against the virus. So it really does two things, right? Kind of like 预防风散 prevention type of formulas, that it treats the virus by itself and it also boosts the immune system at the same time, all right? And that's why you see a lot of the formula from the Hubei or Wuhan protocol to all contain Yuxingcao. Okay, and this next herb is called Wubeizhi Gala chinensis, and this is an herb that most of you probably would not have dreamed to use against an infection or inflammatory condition. And the reason is because this is an herb called the astringent herb, right? It belongs to the astringent herb category. It has binding and retaining effect. And in TCM theory, anything that binds and retains may retain the damp heat or toxic heat in the body, theoretically may make the infection worse, okay? But what actually happens is this herb has astringent function. So it actually may astringe and actually prevent the fluid from flowing from the blood vessel into the surrounding cavity. So this herb actually has good anti-inflammatory effect. And that's what Dr. Jimmy Chang discovered, that astringent herbs sometimes are very beneficial for inflammatory conditions. Not that it locks the inflammation in place, but rather it constricts the blood vessels and reduces the inflammation or the flowing of the fluids from the blood vessel to the surrounding cavities. Okay, so that's its explanation. And in this case, what happened is there are two pharmacological effects to support the use. One is it actually has antiviral effect. So Wubeizhi Gala chinensis has actually been shown to have antiviral effect against Epstein-Barr virus, against HIV virus, okay? And then specifically for coronavirus, this article, small molecules blocking the entry of severe acute respiratory syndrome coronavirus into the host cells. And what it does is this herb contains two compounds. One is TGG, which is tetra-O-galileo beta-D glucose, and also luteolin. These two herbs bind to the surface spike proteins or the virus, neutralize it, and prevent or interfere the virus from binding to the lung receptors and entering to the host cells. And these spikes you see are like the Velcros, okay? They are the Velcros that bind to the lung cell receptors, and that's what allows the virus to enter the cell, start to multiply and cause disease. So somehow this herb, quote unquote, binding herb, actually binds to the spikes of the virus and block it from entering the cell. So I thought that was really cool, how the term actually makes perfect sense in both cases. Okay, so up till now, we talked about some herb, right, that we know perfectly well, like Jinlinhua and Lian Chao, or Benangen and Da Qingye, that we know have antiviral effect. Okay, so that we know already. Wu Beizi is probably something that you have used, but never thought about using for this particular case. And then last herb here is probably something that you have never heard of. I first came across this herb maybe about 6-7 years ago. It's called Xiang Chun Ye, which is Tuna sinensis. And historically, this is an herb that clears heat and eliminate toxins to treat lung heat and cough. Okay, so it's just like many other herbs. It has a very generic, general description. But what happened is, according to this article, Tuna sinensis tender leaf extract inhibits SARS corona replication. Okay, so it's very effective against SARS coronavirus. And in fact, it has two main specific functions. The first one is that the herb, or the extract of the herb, selectively bind to the SARS coronavirus to inhibit the cellular entry of the virus into the host cells. So basically, the virus does not get into the lung cells. And for some that may eventually get in, Xiang Chun Ye also inhibit the replication of the virus to treat SARS coronavirus. So once again, this herb does two things. One is to block the virus from entering the cell, and the other is, even if it does get into the cells, it inhibits the replication of the cells. So it has two primary mechanisms to treat SARS coronavirus. So at the end of this particular study, the researchers conclude that of all the herbs they tested, all the herbs that they took out singularly from Sang Han Lun, discussion of co-induced disorder, and also Wen Bing Tiao Bian, which is the systemic differentiation of warm diseases, of all the herbs they test in the laboratory, Xiang Chun Ye is the most effective herb against the SARS coronavirus. Okay, so that's saying quite a bit. And I think this is an herb you are probably going to hear a lot more in the years to come. Okay. The research of herbal formulas, the only one that I was able to find that's significant is an herbal formula called Yu Ping Feng San, right? And we mentioned this quite a bit already several times, jade windscreen powder. So this is a study that was done in Hong Kong. Basically, the idea, the principle of the formula is to use this herbal formula for the hospital workers when there's SARS epidemic, okay? And basically what they did is they go to 11 hospitals and they recruited anyone that wants to participate. And among the 16,437 hospital workers, 1,063 decided to take herbs. And 15,374 are the non-herb group. Basically, they did not want to take herbs. So they just go about doing their normal work in a normal fashion. And then the others that took the herb and then go about their normal daily activity. This is the breakdown of all the patients, or all the hospital workers, different age, different gender. Some are nurses, some are doctors, some are ancillary workers, and so on. And this is the herbal formula. It's basically a combination of two formulas. The first one is Yu Ping Feng San. Okay, so Huang Qi, astragalus, Baisu, astragalodus, Fang Feng, Saposnicovia, combined with Sang Ju Yin, which is Mori and chrysanthemums formula, and then plus two herbs, Da Qingye Isatus and Huang Qin Scutellaria. And the patients or the volunteers were directed to take the herb every day for 2 weeks. And what they found at the end is of 1,063 patients that took the herb, 0 were infected with SARS. With 15,374 that did not take the herbs, 64 were infected with SARS, and the p-value is 0.035. And what that means is, statistically, we can say with 95% confidence that the use of herbs prevented SARS. Okay, so let me say that again. We can say with 95% confidence that use of herbs prevented SARS. And the side effect, of course, everything has pros and cons, right? So the pro is we have good confidence that the herb work. And the con, the side effect is of 1,063 who took the herb, 19 or 1.8% show minor side effects, including diarrhea, sore throat, dizziness, and nausea. So I think overall, if you look at the big picture, herb show that it worked very well. The drawback is number one, some may have side effect, and that's inevitable. Even if you give them placebo, chances are some will also have side effects as well. And the limitation of this study is that this is done in 2005. Yeah, 2005. So this is specifically for the prevention of SARS. Okay. Right now, we're dealing with what we call the novel coronavirus. So basically the SARS-CoV-2. Okay. So is it going to be exactly the same for SARS-CoV-1 versus SARS-CoV-2? Well, the answer is we don't really know. Okay. Because even though the two viruses are 96% equivalent, there, of course, are probably some differences. But my argument is we are all, especially hospital workers, they have a very high risk of contracting infection, especially if you see pictures of how they are prepared to treat the patients. They at best have a mask and maybe gloves. They don't really have a hazmat suit and so on. So they are, I think at this point, grossly unprepared. Okay, so I think if at all possible, not just for the hospital worker, but also for everybody else, use of the herb, I think, in my opinion, have significant benefit and very little risk, very little downside. Okay, so whether you use this formula, and once again, this formula has Yu Ping Feng San to tonify qi, and Sang Juyin plus Huang Qin and Da Qing Ye to clear heat and eliminate toxins. So some herbs to clear heat and eliminate toxins. Once again, remember the general principle, tonify qi, and then clear heat and treat the toxins. If you do that, generally speaking, you will head the right direction. You will have some effect for the patient, okay? It doesn't have to be any particular formula. They will all work, maybe some little bit better than others, but you definitely want to use that prevention. I think that's better than nothing at all, okay? So in addition to all the Western recommendations, wash your hand, keep a distance, do not get into a big crowd gathering and so on, I would strongly recommend all practitioners and all patients to also take herb, especially if they have pre-existing deficiency. All right. This here is an image of Dr. Wu Youxing. He is the first physician in TCM to start to notice the worm epidemic. It's different from the co-induced disorder. So he is basically the first forefather who started the Wenbing Lun. And obviously, back then, they don't have masks, they don't have gloves. So this is a picture of him going front line to observe, to treat the patients. Okay, so he is basically the father of Chinese medicine as far as Wenbing, worm epidemics go. Okay, and then to today, what happened is, this is a picture, this is one of my favorite pictures. This is the cover of a book called Sanford's Guide to Antimicrobial Therapies. The first time I saw this was in 1991 when I went to pharmacy school. And as I go into the library, bookstores, I came across this booklet and I was really excited, not because of the book, but because of the Chinese characters. So this book is, what pharmacists will refer to as a Bible for infectious disease department. But the two Chinese words were what got me really excited. These two Chinese words is 热病, which literally means heart diseases. And as you flip to the inside front cover, it gave credit to Chinese medicine that 热病, that's described, these two words originally were from Huangdi Neijing, Yellow Emperor's Inner Classic. So the inside cover gave credit to Chinese medicine that what Huangdi Neijing described as heart disease is what we know today as infectious disease. And that many of the antibiotics, including antibacterial and antiviral, that are used to treat infectious disease, in fact, come from the plant origins. Okay, so I thought it was really cool. And this is one of the best integrations of Chinese medicine and Western medicine. Basically, in the end, we're all trying to do the same thing. We're all trying to treat the infection. It's just that the description may be different, that medicine may be a little bit different, but in the end, we are all trying to do the same thing to help the patients. All right, so now where do we go from here? Okay, this is a map that shows total number of cases, and this changes on a daily basis. So it shows how severe the situation is going to be. I think the most important thing for us is to work together with patients, and preferably also work together with Western medicine practitioner at the same time. For the patients, the most important thing is to follow the CDC protocols, basically all the recommendations they have put out. And for us is to educate the public as much as possible. Personally, I feel my role, luckily I'm bilingual with Chinese and English, and also I study Chinese medicine and Western medicine. So I see my role really as a bridge I spend most of my time doing research, doing study, doing translating, and teaching classes like this. So I see my role is to research and write and teach and to disseminate the information as much as possible. And then hopefully somebody pick up the race baton and then run with it, right? And what I mean by run with it is that take this same information and start to educate the public as much as you can, because in addition to the social distancing and so on, there's a lot more they can do to protect themselves, both in prevention and also early phase. So I hope the practitioners who are listening to this webinar can pick up that next step and then help to disseminate the information. And like I mentioned, everything that you see today is readily available at the eLotus website. This is a website that has links to all the Western science information or government organizations, including WHO, NIH, CDC, and FDA. And these are the general Western medicine informations from references such as Elsevier, Johns Hopkins University, New England Journal of Medicine, JAMA, and so on. And these are the ones specifically related to TCM. And in fact, if you click on the very first one, which is the eLotus website, that is our resource center. So it has the previous webinar that I did. If I speak too fast, I apologize. I tend to do that when I'm nervous, or I tend to do that when I have a lot of information to cover. Okay, and then you have, if you want to get the official COVID-19 guidance, it's available in both Chinese and English. It's completely free, so you can click on it, download it, and read it. And then in addition to the integrative approach, there's also the acupuncture treatment protocols, all right? And then lastly, if you have questions, feel free to send me an email. I'll be more than happy to answer any of the questions you have, or get the questions to PCOM, Pacific College, and they will gather all the questions. I will, give you my reply and then send it to everybody. As long as they have your email address, we should have no problem getting the information back to you. Okay, I'm a little bit over. It's not too bad. The original webinar was supposed to be 2 hours, so I just about took every single second. All right, so Cynthia looks like she raised her hand.
Yeah,
so let's see.
John, I want to say, first of all, wow, what a marathon of tremendously useful information. Just know that you're getting a virtual standing ovation on YouTube. Everybody really, really, really appreciated this tremendous amount of information that you got into the over 2 hours. We will set aside the questions. If people have questions, you can continue to type them into the YouTube chat box, and we will capture them and get answers for all of you. But in addition to saying thank you from the bottom of all of our hearts, John, I also want to say thank you to the fabulous Miles Exner, who handled all the technical things for this, and Natalie Tarot and President Jack Miller from Pacific College, our partners at LASA OMS, and all of you there on YouTube. We really appreciate everybody being here. I really appreciate your time, John. Thank you very much.
Well, thank you very much. I really appreciate you guys giving me the platform to help to disseminate and distribute this information. I know quite a few thousands of people have heard this. So I hope the information was useful to you. I tried to do the best I can to put everything in the slides. And also the hyperlink are all active, so if you click on it, it will take you to wherever you need to go. Okay, so beyond that, if you have any questions, like we mentioned already, we will try to get everything back to you as quickly as we can. And then together, hopefully we can get through this crisis as quickly and as safely as we can.
Yes, and for anybody who wasn't here at the beginning of the webinar, John may be too shy to say it, but his books on herbalism are some of the best books available. So you can get those as well. Thank you, John.
All right. Thank you, Cynthia.